Good morning, all. Am I audible? Great. So, starting with the prayer.
भेद भाव अपने दिल से साफ कर सके, दोस्तों से भूल हो तो माफ कर सके, झूठ से बचे रहे, सच कदम भरे, खुद को जय करे, हमको मन की शक्ति देना, मुश्किलें पड़े तो हम पर हित न कर्म कर, साथ दे तो धर्म का, चले तो धर्म पर, खुद पे हौसला रहे, बदी से ना डरे, दूसरों की जय से पहले खुद को जय करे, हमको मन की शक्ति देना।
Good morning. Giving tribute to our great master Samuel Hahnemann, who have found this wonderful divine science and taught us where to be wise. Seeking blessings from our Guru, Dr. Prafull Vijayakar, sir, who have bridged this divine science with the modern science and made homeopathy easy like mathematics. Jai Hanuman, Jai Homeopathy, Om Vijayakaraya Namah. So friends, we are in the journey of reading Organon along with the books The End of My Assumptions of Miasm by Dr. Prafull Vijayakar. So in yesterday's sessions, we have read about the aphorism number 39 and 40 and the footnotes. So that is suggestive of something, a complex disease which is made and how to treat that judiciously. So today we are reading the aphorism number 41. What master is giving wisdom about this to treat this kind of disease and how to handle. So what is aphorism number 41? Much more frequent than the natural disease associating with and complicating one another in the same body are the morbid complications resulting from the art of ordinary practitioners, which the inappropriate medical treatment, the allopathic method, is apt to produce by a long continued employment of unsuitable drugs. These are called as the iatrogenic disease or a disease produced by artificial medical treatment. To the natural disease, which it is proposed to cure, there are then added by constant repetitions of the unsuitable medical agent the new, often very tedious, morbid conditions corresponding to the nature of this agent, which might be anticipated from the peculiar power of the drug. This gradually coalesces with the and complicate the chronic malady, which is dissimilar to them, adding to the old disease a new, dissimilar artificial malady of the chronic nature, and thus give the patient a double in place of a single disease, that is to say, render him worse and more difficult to cure, often quite uncurable. Even at that time, Hahnemann has said that which they were unable to cure by similarity of the action, that is homeopathically. Many of the cases for which advice is asked in the medical journal, as also the record of the other cases in the medical writings, attest the truth of this. Of a similar character are the frequent cases in which the venereal chancre disease, complicated especially with the sora or with the dyscrasia of the condylomatous gonorrhea, is not cured by the long continued or frequent repeated treatment with a large doses of unsuitable mercurial preparations, but assume its place in an organism beside the chronic mercurial affections that has been in the meantime gradually developed and thus along with its often form a hideous monster of complicated disease under the general name of masked venereal disease, which then, when not quite incurable, can only be transformed into health with the greatest difficulties. So, what footnote number 38 said is, beside the morbid symptoms for which, by virtue of similarity, can cure the venereal disease homeopathically, for instance, has among its effects many other unlike those of syphilis, swelling and ulceration of the bone, which if it be employed, which for mercury, if it be employed in a large doses, causes new maladies and commits great ravage in the body, especially when complicated with the sora, as is so frequently the case. So this is what Master is telling about that whenever you are dealing with the case of iatrogenic disease, means the medically mailed disease. In that case, it is very difficult to treat and render justice to the patients. So for that, what you have to do? So you have to antidote the case. This is what it was not written in this, but you have to antidote the case. So many a time you came across the cases of like acute cases, like if you have some case like acute diarrhea and the patient was developed after a medications antibiotic and patient was developed vertigo or patient may develop a giddiness or a patient may develop mesodermal joint pain and everything. At that time you do not advise to give any of the mercurial preparations or any of the antisoric remedy, but at that time you have to antidote the case either with the nux vomica or either with the abrotinum. So this is what the case is. Now we are reading the books, the end of my assumptions of the miasm. So up till now we have understood that the three process that the sora is defended as a physiological process, the psychosis is defended as a morphological structural process, and the syphilis is defended as the morphological destructive process. So going further in the reading of these books, the chapter 8. The cell has only three defensive responses and there can only be three miasms. This is what Sir is proposed. Let's take an example of a man who is under attack from the elements of the hostile world. He is an educated man living in the shanty little house. He is being threatened by the antisocial elements that are trying to evict him. He has three possessions: a pen, some money, and a bread knife. When he finds himself in the problem, he would like to defend himself using whatever things he possesses. In order to defend himself, he will make use of his pen to pen down his complaint to the police or the higher law-making authorities. If he does not get help from them, he shall decide to sacrifice his hard-earned money to buy his safety by appointing a personal guard. And if it also fails to deter the invaders, he may get operate and try to use the knife to defend himself or even kill himself to escape the ignominy of the defeat. So this is what the defense mechanism. On a similar ground, the defensive response of the cell is based on the conserving, using, and sacrificing its possessions. A unicellular animal like amoeba has no possessions. This base living animal has only its function to sacrifice if required. So every living cells or a living organism, which is at least deductively its descendant, also possesses the following three basic functions which can be used to defend and itself. So first, the using or sacrificing the primary or the first functions of the nutrition and respirations, the cell brings about the physiological defense or called as SORA. This response starts with the hypoxia and ischemia, leading to depletions of the energy generations, and this in turn affects the cell functioning and the health. Using or sacrificing the second basic functions of the generations or the cell's capacity to generate, the cells brings about the morphological constructive defense by sacrificing the functions of mitosis, which correspond to the psychosis. Using or sacrificing the third basic functions of the immunity, the morphological destructive defense is brought about. This corresponds to the syphilis. There are the three basic functions of the cells. Therefore, there only three basic defensive response exist. Therefore, only three types of the chronic disease exist. Hence, there can only be three miasms. All others are the pseudomiasm. These comparisons of the SORA to primary physiological defense, psychosis to morphological constructive defense, and the syphilis to the morphological destructive defense, and all disease having their origin is SORA, psychosis, syphilis, was also foreseen by Dr. Hahnemann 200 years back. So, where it was written by Master in aphorism number 74, the most important aphorism in the whole book of the organon is stated that amongst the chronic disease, we must still, alas, reckon those so commonly met with the artificially produced in allopathic treatment. See, this is what we are reading in this artificially produced in the allopathic treatment by the prolonged use of the violent heroic medicines in the large increasing doses by abuse of calomel, corrosive, sublimate, mercurial ointment, nitrate of silver, iodine and its ointment, opium, valerian, cinchona bark, and quinine. Foxglove, prussic acid, sulfur, sulfuric acid, perennial purgatives, vivisection, shedding, streams of blood, leeches, issue, ketone, etc., whereby vital energy is sometimes weakens to an unmerciful extent. Sometimes it, if it do not succumb, gradually abnormally deranged by each substance in a peculiar manner in such a way that in order to maintain the life, so in order to maintain the homeostasis against this inimical and destructive attack, it must produce a revolutions in the organism. So it defend in the organism and either by defend by the following way. Revolutions in the organism and either deprive some part of its irritability and sensibility or exalt this to an excessive degree. So here the first point is sensitivity has to be reduced or sensitivity has to be increased to such an extent, or it causes a dilatations or the contractions, relaxations or the indurations, or even a total destructions of the certain parts and develop a faulty organic alterations here and there in the interior or the exterior, which cripples the body internally or externally. All this happen in order to preserve the organism from the complete destructions of the life by the ever renewed hostile assault of such destructive forces. So this is what how our body beautifully revolved in such a manner. And what is the far-sightedness of the Hanuman that he has written this in 200 years back when there is no evolutions of the pathology and no evolutions of the modern gadgets and microscopes and everything. So in the above aphorism, what Hahnemann talks about the chronic disease, which most often result from the prolonged use of the violent heroic medicines in the large doses. And here he mentions many of them which were in the use at a time. This medicine, he says, weaken the vital energy to unmerciful extent, and more often than not, the organism succumb to it. So it produces revolution in order to maintain the life. This is the fight. It is as if the organism must produce a revolution and defense mechanism against the injurious agents. And if it is to survive, he clearly mentioned the three type of the revolution. The first revolutions either deprive some part of its sensitivity and the irritability or exalt to the excessive degree, as it occur in the complex syndrome, which follows the physiological defense like a rubor, collar, dollar, tumor, functio, lisa. It is SORA. It also causes the dilatations, relaxations, contractions, or the indurations. Here, the dilatations is caused by the less synthesis of the fibrin and causes a psychosis less. Relaxations is caused by less synthesis of the elastin, psychosis less. Indurations of the tissue is caused by excess of fibrin synthesis and it is psychosis excess, or contractions of the tissue is caused by excess of elastin production, psychosis excess. And third, a total destruction of the certain parts. So there means be a necrosis to save the whole, or a develop a faulty organic alterations. That means a part to be distorted or cripple the body internally and externally. It is called the syphilis. So these above three groups of symptoms mentioned are very much similar to what modern science state as a three basic defensive response to the cell to the injurious agent. He clearly mentions that the body adopts these three groups of symptoms as a revolt in order to preserve the organism from complete destructions of the life by destructive forces. This practically settled an arguments regarding the meaning of the miasm, that miasm means the defensive response of the cells. Very important aspect of understanding is the defensive response of the cells. So miasm are the origin of all disease. There are and can only be three miasm if one understands the whole process scientifically. This aphorism number 74 is the most important and the most neglected and most misunderstood aphorism in the book of organelles. So Hahnemann has confessed in the introduction to the chronic disease that the most important discovery was not discovery of homeopathy, but the discovery of miasm. In letter to Dr. Friedrich Gotthelf Baumeister, Hahnemann wrote in 1820, in the homeopathic writings as yet published, there is still lacking the great keystone which binds together all that has been so far published, so that we may be able to improve the treatment of chronic disease. He further writes, by the thousands of experience, I have at last attained my object. None of my pupils as yet known anything of this invaluable discovery, the work of which to mankind exceed all else that I have ever discovered, and without which all existing homeopathy remain defective or imperfect. And this aphorism number 74 holds the great keystone, the keystone which solves the mystery of incurable disease, the keystone which reveals that the organism revolved only three different ways to give rise to three different type of disease at the base of which are the miasm, sora, psychosis, and syphilis. In chronic disease, page 434, Hahnemann says that in Europe and also in the other continents, so far as known, according to all investigations, only three chronic miasms are found. The disease caused by which manifests themselves through the local symptoms and from which most if not all, the chronic disease originate, namely the first syphilis, which I have also called the venereal disease, then psychosis or the figwort disease, and finally the chronic disease which lies at the foundations of the eruption of the itch, that is the sora, which I shall treat at first as the most important. Modern research says that inflammation is the first response of an organism to the cell injury. The two morphological defense are responses are only secondary to the first. The primary response of inflammations is from the childhood and no individual can survive without it. Therefore, SORA inflammations is the mother of all disease. Psychosis and syphilis are only secondary to the SORA because the destructive and constructive pathology cannot exist without the primary inflammation. Since nobody can survive with the first physiological response, nobody can be free from Sora. So this is what we have to bridge this our knowledge of Sora as the primary response, psychosis is the secondary response, and syphilis is the secondary response. So in Sora, the primary response associated with the inflammations of the cellular level. In psychosis, the secondary response is associated with the change in the structural constructions, and in syphilis, the change in the structural destructions. Now we are learning acute sora. See, sora can be acute and sora can be chronic. So even in Hahnemann has given that the sora is acute and sora is chronic. So chronic sora, that's why it was given as chronic disease, chronic sora. Now acute sora. The physiological response of a cell or a tissue of individual can be suddenly so intense that it might result even in death. This acute inflammatory response is what Hahnemann calls us as the outburst of the latent sora, which equate to the acute disease. In aphorism number 73. In aphorism number 73 extract, as regard in acute disease, they are either question answer will be at the end, doctor. We will take care of everything. Organon aphorism number 73 extract as regard acute disease, they are either of such a kind attack human being individually, the exciting cause being injurious influence to which they are particularly exposed, either excess in the food or insufficient supply of it, nutritional imbalance, severe physical impressions, chills, overheating, dissipation, strain, etc., or a physical irritations like the physical agent or a mental emotions and are the like are exciting cause of such acute febrile affection. In reality, however, they are generally only a transient explosion of the latent sora, which spontaneously return to its dormant state if the acute disease were not of too violent a character and were soon quelled. It is worthwhile comparing the thoughts and idea about the causative factor purported by the Hahnemann about 200 years ago and with the cause of the cell injury mentioned in the Robbins pathological basis of the disease. So causes of the cell injury. The every disease start with the injury. The causes can be reversible cell injury and the cell death range from. So agent which can impede oxygenation or causes ischemia like a nutritional imbalance, physical agents like a mechanical trauma, thermal trauma, sudden change in the atmosphere pressure, radiations, electric shock, chemical agent like anything which derange the electrolyte homeostasis of the cell, air pollutants, insecticides, pesticides, herbicides, carbon monoxide, asbestos, alcohol, narcotics, drugs, ever increasing variety of the therapeutics drug, infection agent like the virus, bacteria, fungi, parasites, immunological reactions leading to anaphylactic reactions, foreign protein, and endogenous self-antigens are supposed to cause autoimmune disease. And the genetic derangement are hereditary or acquired causes of cell injury. All the above factors causes cell injury and bring out the cellular defensive response, which may start as a reversible and end in irreversible or death. Interestingly, Hahnemann has mentioned almost all the above cause as the exciting cause and the injurious influence which causes, as he stated, transient explosion of the latent sora. They are of a such kind as attack several persons at the same time, is infectious agent or individual. The meteoric or telluric influence, the physical agent like atmospheric changes and radiations, and the third, the injurious agent, which is chemical agent and drug, the susceptibility of being morbidly affected by which are possessed by only a few persons at the time. Here, Hahnemann implies the genetic predispositions and immunological reactions. He later on mentioned about the epidemics, contagious and infectious disease which are due to infectious agent. He further mentioned about the war, inundations and the famines as injurious causes. So 200 years back, Hahnemann has mentioned all the probable ailments which can injure a cell and set about the physiological defense response. Over and above, he goes one step ahead and has mentioned the emotional disturbances too as the cause of injury to explode the latent sora, the physiological defense, that the modern scientist is still not aware of it or if aware at least does not take into consideration when assessing the causative factor or for treatment. So acute disease as mentioned in aphorism number 72 and 73 are due to the burst of latent sora. This could be very well equated to the acute inflammations or the complex symptom syndromes, which is associated with the cell injury. Such inflammations, if not resolved, end in either a certain death or structural morphological damage. In certain conditions, as of a pneumonia, gastroenteritis, viral meningitis, the physiological response to stimulus, a bacteria, virus, or toxin, is violent in proportion to the attacking agent. Here, the natural immunity of patient is virtually helpless and is thrown out of a gear. The physiological response of the cell or a tissue of an individual can be suddenly so intense that it might result even in the death. This acute inflammatory response is what Hahnemann called as outburst of the latent sora, which equates to the acute disease. Aphorism number 73. Again, in aphorism number 72, he mentions that the disease which have tendency to finish their course more or less quickly are the one which dynamically derange the living organism, each in its peculiar way, for example, genetically governed, causes it to gradually deviate from the healthy conditions. The vital force or immunity only oppose it at the commencement and put up useless resistance in the progress and helplessly suffer until the organism destroyed and they are called as a chronic disease. Thus, the disease start with the acute inflammations and progress to the chronic inflammations and further to the indurations and or to the ulcerations and destruction. So this is what we have to understand. In aphorism number 63, Organon, he again mentions that the every agent that act upon the vitality every medicine deranges more or less the vital force and causes a certain alterations in the health of the individual for a longer or a shorter period. This is termed as primary action. Although a product of the medicinal and the vital power conjointly, it is principally due to the former power to its actions, our vital force endeavor to oppose its own energy. This resistance action is a property, is indeed an automatic action of our life preserving power, which goes by the name of secondary actions or the counter action. So this is called the resistance power. Hahnemann mentions that every agent and every medicine deranges the vital force and causes alterations in the health for a longer or shorter period. The vital force endeavors to oppose it. This resistance actions is property or automatic actions of our life preserving power. It means that our vital force or the force which pervades our cells and tissues and the whole being in its own intelligent way to trying to save our life. So this guide us that any changes in the cellular level in the form of acute outburst in the form of inflammation, it is just as the outburst of the latent sora. But if the latent sora is of not too violent character, then it again subsides to the normalcy and homeostasis is maintained. But if it is not taken care, it may either produce a revolutions in the body and produce changes at the cellular level, producing the chronic inflammations to the indurations and finally end into destructions and death may ensue. So this is what you have to understand in the form of pathological point of view. Now, why we need to learn this all these things? Because first and foremost things, when you go to the theory of Ayurveda, so Ayurveda has the only three components that the Vat, Pitta, and Kapha. So when we are treating the disease, they need to find out the three basic causes of that the patient having a Vat, Pitta, or Kapha. So same way, what we need to understand is that if we are treating any of the disease, the patient came across to us, we need to categorize the disease in the three component of the miasm that what patient is right now at the cellular level in a soric state, in a psychotic state, or a syphilitic state. According to that, our strategy has been made, and according to that, our treatment plan has to be made, and according to that, we can deal easily with the homeopathic management. So this is what our understanding of learning miasm. So we have to categorize each disease in terms of this disease in either a sora, disease in psychosis, or disease in syphilis. So for that we have to understand the pathogenesis of a particular disease at the physical level. Initially we are learning the physical part, then we shifted to the mental aspect. Okay. So the pathogenesis of the Sura or the physical disease of the Sura, how Sura represent to us in the physical form. So whenever we have a certain disease in front of us, we have to understand that this is a soric case, this is a psychotic case, this is a syphilitic case. In the soric case, we have a two category, the acute soric case and the chronic soric cases. Okay. So in acute soric case, we need to consider the acute cause. In a chronic psoriatic case, you need to consider the constitutions as a whole. So this is what our treatment plan according to the defense mechanism which the patient is having. So pathogenesis of the sora at the physical level. So soric disease which are characterized by the altered sensitivity or irritability and it is represent in the form of acute inflammation. So if we go to the particular organ of the particular body, for example, the skin, in all acute inflammations and hypersensitivity and irritability, itch, dermatitis, boils, rash, miliary rash, oozing eczema, cellulitis, all are the psoric in nature. Okay. there is a very fine line between a sura and it goes into destructions. So you have to keep yourself in a mind that might sura get into a syphilitic destructive tendency. So here the cellulitis in the initial state is a soric, but when the cellulitis is presented with the ulceration, that means it goes into directly syphilis. So keep in mind that the presentation has to be very important. The respiratory tract having the inflammatory changes like rhinitis, pharyngitis, tonsillitis, bronchitis, tracheitis, pneumonitis, pneumonia, etc. Hypersensitivity of the trachea causing asthmatic bronchitis, spasm, allergic manifestations. These are the SORA. GIT, esophagitis, gastritis, hyperacidity, colitis, hyperperistalsis, hypermotility, diarrhea, acute hepatitis, acute cholangitis, acute pancreatitis, acute proctitis, appendicitis, irritations due to worms, irritable bowel syndromes, etc. are to be taken as a SORA. Locomotor systems, the acute arthritis, inflammations of the cartilage of the joint between the vertebrae, spondylitis, laryngitis leading to the hoarseness, myositis, tendinitis, a deeper disease, for example, the primary complex, pleuritis, endocarditis, pericarditis, vasculitis, stress diabetes, viral thyroiditis, meningitis, encephalitis are the psoriatic in nature. The symptoms arising out of the infections or inflammations, irritability, etc., are the acute spasmodic pain of the abdomen, acute sciatica, paroxysmal neuralgic pain, neuralgia, convulsions caused by the inflammations or irritation, not by the space occupying lesion, which are psychotic convulsion, and not due to destructive pathology of the nervous system, which are syphilitic in origin. This is not an exhaustive list of the psoriatic pathology. Any disease or a symptom at the origin of which lies hypoxia or ischemia, that is the deprivations of the nutrition, respirations and evacuations or the neural control of the cells and tissue can be clubbed into this list of the disease. At the same time, the behavior changes or the emotional changes, acute irritations at the neuroendocrine level, especially at the juncture of the neurotransmitter production, may cause sudden outbursts of the anger, fright, grief, anxiety, which could be transient but repetitive or purely psoriatic in origin. All transient phenomena are psoriatic. When the disease shifts from one system to another, for example, after suppression of the diarrhea or any discharge from the respiratory tract, the patient may show the sign of transient inflammatory process in the cartilage and joint. This incorporates dynamism. For example, the pain can come and go before it becomes permanent in the new place. This exhibition of the dynamism is purely psoriatic before it translates it into chronic inflammation or the chronic rheumatoid arthritis, which is autoimmune syphilitic in origin. Most pain or the complaint which are transient, relapsing, associated with the high fever or eruptions could be psoriatic in origin. Note, malarial fever, though it is a transient relapsing with the high fever, is psychosis and not the SORA. This is what Sir has mentioned. The answer will be given later on. The physical structure, the typical the psoriatic face is a normal, proportionate face, more or less long face with the tapering chin. They have a sensitive eyes, medium-sized nose, and not too big or not too small for the face. This face does not show excess fat or roundedness. The nose is neither too sharp nor rounded. Wounds are clear-cut, superficial, neither deep nor destructive. Wound heal without scar. These are the physical structure of the sora. So hope you all get the idea of the physical structure. We are dealing with the physical disease of psychosis tomorrow because it was too vast and very easy to understand. But you have to keep everything into your mind so you can easily understood this with the pathological point of view. So we have a questions. One of the doctor asked, how can a response be the cause of a disease? Please explain. Dr. Sunita, please explore your questions again so we can have the question answer session in a proper way. So what you understood from this point of view that what is a SORA? SORA is just the inflammatory response of the body and it is a transient in nature and it may end into recovery. But if it goes into destructive, then the SORA may convert it into psychosis also, is a chronic SORA, and SORA may convert it into syphilis also. Okay. How can response be the cause of disease? Please explain. Dr. Sunita, please explore your questions in detail so I can, yeah. Miasm are response of the body and the cause. Again, please. See, miasm is our body's defense mechanisms. Simple understanding or see, we are confused with the term miasm. We have to understand our body's mechanism that our body is depending to survive. Simple. If I have to survive in a proper way, any hostile force is in front of me. So I have to survive and I have to adapt into situations. So our body has governed by a certain process and that process is called as a defense mechanism and which we call as the internal doctor which we call as the vital force and everything. So miasm is what something that it is a response of the body in a different form. So our body is defending in a different form according to the exposure to the causes. So if persistent miasm inside the body is genetically governed as a psychosis, then the body is primarily defined with the SORA with the shorter duration of time and then it goes directly to the psychosis. If a person is having a soric tendency, which is associated with the genetical governance, so that they respond everything in a soric way. So every disease. So this is what a miasm is a response of a body against the hostile trauma. Or the trauma can be physical, trauma can be mental, trauma can be psychical and everything. So our response is governed by the miasm. So if I respond in a soric way, then the disease also develop in the form of SORA. Disease is the outward manifestations of the response of our cellular mechanisms. Okay. So same way, whenever the patient comes to us, we need to identify just what we have to understand that the disease. So what disease he is taking to us and what we have to treat. So first and foremost thing we need to understand knowledge of the disease. So knowledge of the disease guide us that the disease is in a three category. Either you have to find out the disease in a soric state, disease in a psychotic state, or disease in a syphilitic state. This disease is destructive, this disease is constructive, or this disease is physiological in nature. So once you understand that, then and then you understand this is a miasmatic response of the body. According to that, our treatment plan also changes. So if it is an acute SORA, most of time you came across all the disease which we called as acute diseases. So in that case, what you do? Just prescribe some medicines which is taking care of the cause or the effect of that acute disease. Okay, that has the only thing. Sometimes you didn't find any causative factor in acute disease, but you find the uh, reactions of the acute disease in terms of some PQRS symptoms. So that you have to take into consideration. What Master Hahnemann said in aphorism number 82, it was that acute disease is very easy to treat. It is just a outburst of the latent SORA, and every symptoms is striking to the physician. So when the symptoms is striking to the physician, no time has to be wasted and no time has to be taken care. So you have to treat very easily with this. So here the miasm is a response of our system, our cellular system, and to the cause. So miasm is a cause, but what is the cause? The cause is the SORA. SORA is the cause, and it represents in terms of the disease. So here we have to understand disease as the defense mechanisms of our body system at the cellular mechanism, and that body system cellular mechanism is represent us in the form of three process which we called as the physiological process is the sora, the constructive process is called as a psychosis, and a destructive process is called as syphilis. Hope you all got it. Yes, Dr. Sanchita, it was the abrotinum, rightly said by Ria, and many more. No, camphor is not like that. Camphor is a vegetable antidote to vegetable medications. Camphor. Hope you all got the basic idea about the sora. We will continue with the psychosis. See, for this understanding of this, you need to understand the process called as the pathology. And for that pathology, you need to read the pathology book so that you can understand very beautifully our body's response, how body is responding to us. What we are dealing with, we need to deal the patient. We need to deal the patient with the process called as what patient is coming to us in which phase, either in a soric phase, either in a psychotic phase, or either in the syphilitic phase. What are you asking for? What is to be considered in long site or long site disturbances? Can we correct it? Means what? So visual disturbances. Are you asking for? So those who are wearing spectacles. So there is a myopia and refractive errors. Yes, yes, yes. Yes, refractive error comes with the accommodation problem of the muscle, so it may be a psychosis. So there are the causes behind that, and you need to find out what are the causes related to this. So in refractive error, in the eye, there are the process. Myasthenia gravis is a autoimmune disorders, and it is a syphilitic in nature. In the eye, everything is related to short-sightedness, means the myopia, and the long-sightedness is the hypermetropia. So this is happening because of the certain conflict they are associated with. So we need to go deeper later in this case, but it can be corrected with the homeopathic medicine. If your medicine is right, the refractive error has been changed. Many cases is encounter that the number of their spectacle has been reducing after the homeopathic medicines. Approach will be taken later on. Any inflammations approach is acute. If it is a chronic, then GCS. There's a two different things. I had shared the slide in the group previously when I had read the books on the modern science and medicine. In that case, I had explained the 3 pages that in acute cases, the response in acute SORA, the remedy is prescribed on the basis of the cause and it is a non-episodic or the acute state remedy. Whereas in a chronic cases, you need to prescribe a GCS. And for GCS, you need to understand the genetic constitutional simile. You need to understand the will, intellect, moral, attachment, sensitivity, extroverted, introverted, physical aspect, and general aspect of the patients.
Sir, it is like Lux Omega will be used like Ibrutinib and all for the allopathic medicines
It
when
is
we are when there are
just a
separate cells.
physiological case, not in the pathological case.
No, sir, I'm asking about if we mess the case with giving so many homeopathic remedies and the patient is not improving,
Hmm.
So if we have tried many medicines, then is there something which you have to antidote with some homeopathic medicine to
Sir always
uh,
advise that if it is the physiological in nature and the wrong homeopathic medicine has been prescribed, then the sepia is indicated.
okay.
And if it is a pathological in nature, then the right GCS will take care of everything. No other
Oh,
medicine to be antidoted.
oh,
Okay.
thank you, sir.
Macular degeneration of retina age related can be treated. Yes, sir had many cases, and we have seen that it can be treated with the homeopathy because it is a syphilitic. So you have to treat the syphilis. So you have to taken care into syphilis. Pyelonephritis conflict. Don't go directly to the conflict, doctor. Many a time the theory of conflict will just help you in the case taking, but you need to take a whole case. Sometimes your case is giving you PQRS and you are in search of the conflict, so that you must miss that the PQRS and you are behind the conflict to find the cause. Okay, so you have to assess the case and then finally ended with that this conflict can be the cause of this disease and this perception can be the cause of this disease. This is very important to understand. Sometimes when you are making everything in a shortcut, then you miss something which the patient is giving to you. Okay. I had read somewhere in the books that the first 5 or 10 minutes of the case taking is the most important in the case that will guide the whole history of the patients and the PQRS. But once you have to understand that things, so don't directly ask for the conflict. For approach, the conflict is needed, and that will help you to surety of your prescription in also. But take a whole history in a deep sense so that you might get conflict directly from the history only, not to ask for the conflict. Because many a time what we learn, see, my understanding of the process is when you are learning a new things and when you are learning the process that help you to understand that your process of analyzing become short. Your process of analyzing become very quick when you learn many things. But when you learn many things, then your process of analyzing will increasing. That means you have to keep in mind that your learning is going in a wrong directions. Okay, so that is what you have to think into considerations. Okay, so every learning will give you a process of analyzing very easy. So whenever your process of analyzing becomes easy, that means you are learning in the right directions. But if it is going too vast and lengthy, that means your learning is somewhere in the wrong directions. In accommodation defense, if we get a conflict, we have to give GCS or according to recent delusion, GCS. GCS will taken care of everything. Again, you have to keep in mind the disease of long standing will take a longer time or more time to treat. It was also mentioned by the Master Hahnemann. So do not expect that the psychosis will go easily by 10, 15 days or 1 month or 3 months durations. Because the most enthusiastic homeopaths will have the idea that if I give a medicine in 90 days, it will go on. So it is not like that. If it is an acute, the everything is fast. If it is a chronic, then the response will be fast. You will get the idea that the patient is curing himself. But the end product, everything will be gone. It will take a longer time. It was what Master Hahnemann has mentioned. Is PQRS most important than the GNM? Yes, absolutely, doctor. PQRS is the most important. What Master Hahnemann has said in aphorism number 153, what Vijayakar sir always said that you have to take into consideration the syphilis. The all syphilis is nothing but it is a PQRS. So that is what PQRS is most important than the GNM. GNM just guide to understand the man. GNM just guide to get the history. In most of psychotic cases, you need to ask certain questions, and the patient will open up that this could be the possible reason behind the cause. So this is what the GNM will help you in a case taking. GNM will not teach you any miasm, and GNM will not give you any remedy. Okay, the PQRS itself is the remedy, and you need
Sir,
to treat the main. Just a minute, Dr. Hitul. I need to finish two, three questions. Please guide about antidoting with the sapia in cases of physiological cases. Potency of the sapia is 200, and the physiological cases means what? Whenever after a certain medicine, the patient becomes so dull, indifference, and his energy goes into liver trophy. In that case, you need to antidote with the sepia. For more understanding, you need to go to the YouTube video which I have uploaded in YouTube channel, Happy Gujarat channel, the sepia. So you can go to that channel. I will share that link into group so you can get the idea of sepia. Yeah, we'll share the notes of approach. Yeah, sure. Yes, Dr. Hed.
Sir, you as you said, na, in this psychotic cases, you need to have patience and all. So, sir, if in case of like a patient got the menarche and then after that 2 3 years she never got the menses. So, in this kind of very psychotic patients, how long we should wait after giving the constitution so called we have decided? Means how much
See,
patience in such type of.
simple things is physiology has to be established. Menarche and the PC, you are asking about the case of PCOD.
Yeah,
So in
yeah, sir.
PCOD, in case of PCOD, the physiology has to be maintained. So what is the physiology of normal menstrual cycle? 28 to 35 days max to max. After that, the period has to become. So here
Yes.
the PCOD means that means the patient having a 2 3 months amenorrhea, 4 months amenorrhea. Whenever the right medicine has been given, the patient will develop a regular menstruations. For that, you need to go to the approach of PCOD, which I have uploaded in my YouTube channel, and see it. So you will get the answer of everything in that video also.
Okay.
Okay. Fine,
Yes.
it is a deep whole learning. It learning for the almost 2 hour study. So you need
Okay.
to go to that video and listen that and extract something from your case. Okay, so you will get
Yes.
it. And I had said in that video that if you don't have any conflict, you cannot find in a conflict of that also, then also you can treat PCOD. So this is
Okay.
what sir is what sir is trying to deal with the case. Sir is cracking the case, and then after sir has evolved, so sir has added the story that the case taking is very easy when you add the knowledge of conflict, so that your case taking becomes short. But this case taking does not give conflict, does not give you any medicines. The conflict will give you the constitution's dispositions. Okay, how the person is responding to that. And after that, you need to find out some PQRS of the patient, and that PQRS gives you a remedy. Okay, so that you have to take into considerations. Hope you
Okay,
all
thank you, sir.
get.
I'll go through the list. Uh,
Yeah, yeah.
but one of my patients, she got her menses after 4 years with so-called GCS, I decided, and after 1.5 months. But then after repetition also and increasing the potential, so she never got after that. So
Your
I should
remedy is not
waited
not
for
your
the.
remedy is not touching the constitutions. Absolutely. It
Oh,
might be a natural response of the body that comes after 4 months. What I experience
yeah,
whenever you are giving a medicines, na, see, simple. Anovulatory cycles happens, and if you learn the physiology of the case, when there is an anovulatory cycle happens, after that anovulations, ovulation has to occur, and ovulation has to have after ovulation the last 14 days is the physiological point of the day where the progesterone has released and progesterone depletions happen, and then the menses happen. So if you are prescribing any medicines, your patient must have a 15 days or a 20 days span. In that 20 days, the patient had a menses. So that is what your remedy is, right?
Hmm.
Okay, this is
Okay.
what I learned personally from my experience that so if it is an ovulatory cycle, the ovulation does not occur. So that means what you need to just search the LH. So after prescribing your medicine, LH surge happen, the progesterone cycle start, and then progesterone cycle deplete to such an extent. Then and then the patient having a menstrual cycle. So after a medicines, if it is 14 or 20 days, then your medicine is right. This is what my personal experience is.
Okay.
Okay.
Okay. Yes, sir. Thank you so much.
Next crack on the foods is the syphilis. You have to treat the syphilis. Tendency has to be the syphilis. So anti-syphilitic medicine has to be prescribed. When to select Naxomica and when to select Abrotenum for the antidoting, as you said in case of pathological cases where the medicine were wrong. Yes, in pathological cases, don't take this. This is just an antidoting. Naxomica is a fast remedy. Abrotenum has the mesodermal shifting of the disease from the endoderm to the mesoderm. So in that case, you can prescribe Abrotenum. For that, you need to understand both remedy in depth. If the patient having yes, if the patient having the patient is adult, but in the childhood it was the cracks, but now the patient having a cracks or not, the question is that then no need to treat, body has taken care of the syphilis. But you have to keep in mind that after medicine, if the cracks is happening, that means you are just not stimulating the constitution and strengthening the constitution. To strengthen the constitutions and the next winter patient do not develop cracks. That is what your idea of treatment by prescribing the GCS. Hope you all got. Thank you. Thank you all. So we will continue psychosis from tomorrow. And the psychosis is a vast subject, so we have to deal with many of the cases come to us in the psychotic miasm. Okay. Thank you all. Thanks a lot.